Good morning. Thank you for being here, and you can state your name for the record and please begin with your testimony.
Good morning. My name is Sara, Jann, and I'm the Executive Associate at Maternity Care Coalition. And I'm here today to testify in support of Bill number 160811. Maternity Care Coalition is a Philadelphia-based nonprofit organization which works to improve maternal and child health and well-being through the collaborative efforts of individuals, families, providers, and communities. Many Philadelphians know us as the Mom Mobile, or as the largest provider of early Head Start in the state of Pennsylvania. And for more than 30 years, Maternity Care Coalition has worked tirelessly to improve the quality of life for pregnant women, infants, families, and children ages 0 to 3, which is why I'm so pleased to be here today to speak in support of this bill. I am also a mom. I have a 16-month-old son, Casper, and I'm the spouse of a city employee. So unfortunately, I have had the unpleasant experience of changing my son on the floor of a restroom in a city building. Aside from the obvious sanitary concerns, I want you to know that in doing so, I felt as though my baby and I were unwelcome. Philadelphia has already taken the lead on ensuring breastfeeding accommodations for working mothers and protecting every mother's right to breastfeed her baby. This bill is an ideal opportunity for the city to demonstrate its ongoing commitment to supporting Philadelphia's families with young children and welcoming all families to our city. I'm sure this won't come as a surprise to most, but being a parent is hard work. Young parents shouldn't have the stress of not knowing where they can change their babies. For us city parents, it's impossible to carry around all the things needed to care for a baby on a given day. We have to rely on our communities to be conducive environments in which we can care for our babies. So when a parent visits a city building and has to scramble to find a place to change their baby, the message is that babies and families are not expected or allowed to be in these facilities, and that the needs of a child are not important. As caregivers, we learn to adapt. Many of us know where we can go to find a clean place to change our babies. But dads and male caregivers are almost entirely out of luck. The lack of places for men to change their babies perpetuates the problematic notion that caring for children is strictly women's work. Is this the message the city wants to send, that parents must go elsewhere to find a clean place to change their babies? Also worth considering are the millions of tourists, newcomers, and potential future residents that visit Philadelphia annually. What do we want their impression of our city to be? This bill is a prime opportunity for the city to do something small to support families in a big way and set an example for other cities. At Maternity Care Coalition, we are proud to be a Philadelphia-based organization, and we are proud of the city of Philadelphia for the strides it has already made as a family-friendly city. We are constantly asking ourselves, what do families need and how can we better support them? In considering this bill, I urge you to ask yourself the same question. Caregivers, both male and female, need a safe and clean place to change their babies. Philadelphia must welcome babies and families to its publicly accessible buildings. This bill is both a vital and logical step for the families and for the city of Philadelphia.